The gentleman from New York is recognized to offer his amendment.
Thank you, Mr. Chairman. This amendment seeks to clarify one of the great enduring mysteries of the debate about health care, and that is where my Republican friends stand on the issue of government-run health care. Now, on one level, it's very clear. Quotes throughout the debate have seemed to imply that they're against it. Mr. Stearns of Florida said, if the government runs it, it will be bureaucratic and efficient. Many cases will not cover the people who want it. Mr. Terry of Nebraska, government-run health care will lead to rationing, eliminate the sacred doctor-patient relationship. Mr. Blunt said, on health care reform, the marketplace is the only known mechanism available to deliver what people want. Now, I raise this subject because today is the 44th anniversary of President Johnson signing the Medicare Act into law. Now, the Medicare Act, as all of my colleagues know, is not only government-run health care, but it's remarkably good government-run health care. Now, I was criticized earlier for having shoddy charts, so I got a little fancy. On this chart, you see that not only is Medicare public health care, but also we have DOD, Veterans Affairs, and Indian Health Service. Now, this is not only government-run health care, but it's remarkably efficient. 3% overhead in Medicare, compared to about 30% in the combination of overhead and profits by the health insurance companies. Remarkable satisfaction on the part of the contractors. In the last national scoring that they did of the contractors, it got a 4.1 on a 6-point scale. And frankly, we know it works. We know that when Medicare before Medicaid was passed, we had a poverty rate of seniors of about 30%. Now it's about 10%. We know also that the private insurance companies take about $600 billion a year and put it in their pockets, not into health care. Now, some people have held up this chart, this Byzantine chart, that talks about how they think the bill works. Well, I've got my own chart. This is Medicare. 3 boxes. The patients, the doctors, and the one single payer. So this amendment is simple. It gives my Republican friends the chance they've been waiting for to vote against government-sponsored, government-run, government-administered health care. It's your dream amendment, unless, of course, you're going to continue to do this Sybil impression when it comes to Medicare. First you like it, then you don't like it, then you like it, then you run against it. The fact of the matter is that Medicare is a pretty darn good model of what a public plan might look like. Now, it's not perfect. There are reimbursement rates in some cases I think need to be higher. I think we incentivize too much to go into hospitals and not enough on the other side. Some of the things that are being done in this bill. But this is your opportunity, once and for all with my amendment, to vote to eliminate the Medicare Act. Once and for all, stamp out the scourge of public, government-run, government-administered, single-payer health care. This is your chance. And you know what? For all of the talk about how much you hate such programs, I think you'd welcome this opportunity. Now, I'm going to vote no, and I'll tell you why. Because I think the Medicare program works pretty darn well. I think it's administered efficiently. I think that you ask seniors, if you tell someone tomorrow who's 55 years old, you're going to get Medicare, that we're going to start covering people 55 to 65, and then maybe 45, and then 35, and who knows, maybe Medicare for everyone, you'd have a lot of people who would be pretty happy. There have been a lot of elements of this debate that have been hard to follow. I admit that. But one of the hardest has been the utter hypocrisy and contradiction inherent in the arguments of many of my friends on the other side. This is put up or shut up time. If you don't like national health care, if you don't like government-run health care, this is your amendment. I dare you. I double dare you. Vote yes on this. And then go home and explain to your constituents how you're so philosophically opposed to publicly funded health care that you voted to eliminate Medicare on its 44th anniversary. And let me just say this, since I only have 27 seconds left. There's one member here who voted in favor of Medicare when it was created and who was present when it was signed 44 years ago. And on behalf of all of us, I want to say publicly, I want to thank him for being there for us 44 years ago when it was signed, and God willing, he will be here to watch this be signed, where we extend another example of efficient, sound, publicly funded, publicly administered health care. And I yield back my time.
Parliament.
Time